Life is very precious. The sign of being alive is the continued pumping of your heart. When your heart stops beating, you can get into a cardiac emergency. A medical emergency may occur at any time to any person. As per the World Health Organization census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers. The concerning change in recent times is that the onset of heart disease is now seen at a younger age, especially in young people who are in their 30s and 40s. The biggest reason for heart-related deaths is a lack of awareness as to what needs to be done in a cardiac emergency. So every adult should know which conditions qualify as heart-related or medical emergencies. The best one can do is to learn beforehand the actions required in case of a cardiac emergency. Life-saving techniques such as CPR give you the power to save a life. It has been proven that bystander CPR improves the rate of survival by almost 50%. It is even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Brian Pinto, Chief of Cardiology and Director of Cardiac Catheterization, Holy Family Hospital and Swarna Heart Clinic, Mumbai. We're also joined by Dr. Manju Sinha, Chief Anesthesiologist and Medical Director at the Women's Hospital in Mumbai. And also on the broadcast with us, Dr. Yash Lokhandwala, Consultant Cardiologist and specialized in heart rhythm disorders from the Holy Family Hospital in Mumbai. Thank you so much, doctors, for being with us on this show. Dr. Pinto, I'd like to begin with you. For our viewers' benefit, if you could please break down what actually happens to a person during a cardiac arrest.
Cardiac arrest actually means that the heart stops. It's very different from a heart attack. A heart attack can cause a cardiac arrest in which actually the heart muscle starts trembling. And when it trembles, it becomes an ineffective pump. And therefore, the person loses consciousness, usually falls down and stops breathing. This is very important to recognize because 30% of heart attacks lead to sudden cardiac arrest. There are other conditions as well that cause cardiac arrest. But it's important that the bystander recognizes this and is one who can take up this immediately. So the only two things that a bystander or anybody needs to do is to recognize that the person who has fallen down in front of you is unresponsive. That means you tap him on his back or you tap him on his shoulders and you find that he's not responding. And number two, he's not breathing. It is not essential to feel his pulse or anything of that sort, because that wastes time. And immediately after that, you should be starting CPR on this patient. That means you start cardiopulmonary resuscitation. And in this days and age, you don't even need to give mouth-to-mouth respiration. All you need to do is give cardiac massage and then follow it up. I think this is the important fact that we need to put on to people, because this is the area in which we will be able to save a lot of lives.
Breaking down those details for us as far as the cardiac arrest is concerned, let's also rope in Dr. Yash Lokhandwala at this stage. Doctor, many heart attack patients die before they reach a hospital, and we know that the sooner the person gets to the emergency room, the better the chance of survival. But prompt medical treatment reduces the amount of heart damage. So can a person help himself during a heart attack? And if yes, how?
It's a good question. Many times we find a delay in recognizing a heart attack. And one of the causes of delay is people pass it off as this is some acidity. Now, if someone is in the age group of, let's say, 20, 25 and is not a smoker and is a healthy person and has eaten outside or gone to eaten some food with friends, it may well be acidity. But if a person is 50 or 45 plus or is having blood pressure or a smoker, having family history, and that person has some discomfort in the chest, do not pass it off as acidity. It could be a heart-related pain. It could even be a heart attack. So the first thing to do is call for help and seek medical attention. Now, medical advice, if you are suspecting a heart attack, best is to go to the closest hospital rather than wasting time in going to any doctor's clinic. What one could do in that case, if there is aspirin at hand, one can take a tablet of aspirin, stay calm, don't panic. Take rest and get somebody to take you to the closest hospital. That's what one should do when one is getting discomfort and suspecting a heart attack.
Right, Dr. Sinha, most people don't know the difference between heart attack and sudden cardiac arrest, and many may not recognize the symptoms of sudden cardiac arrest then. So how does one know if it's a primary cardiac arrest?
That's right. Many a times what happens is the terms cardiac arrest and heart attack are wrongly used interchangeably, because they not only differ in their mechanisms and their presentations, and also differ in the way that you will respond to the situation. A heart attack is when there is a blockage to the blood supply of the heart. So patient may present with pain in the chest, which may radiate to the left arm, left jaw, or the back, and the patient is conscious. While in a cardiac arrest, what happens is the electrical supply, which initiates the blood supply, the pumping of the heart, that goes awry. So there is no blood being pumped to the vital organs, especially the brain, and the patient loses consciousness and stops breathing.
Dr. Pinto, can high intensity exercise acutely increase the risk for sudden cardiac arrest or sudden cardiac death in individuals with no prior history of heart disease?
Actually, this can be answered in one word, saying yes. But I would like to bring you out to the World Cup that just occurred, the Football World Cup that just occurred. And all of us saw Christian Eriksen, the captain of the Denmark team, fell onto the floor while the exercising. It's clear that today, even in people who have no heart problems, or who have heart problems that you have not found out before, that there could be a sudden emergency and there could be a sudden cardiac arrest. This could happen in many situations, and I divide them out into two. Those above the age of 35 or 40 usually have this during an intense exercise because of a plaque rupture, that is a small blockage in the heart which is full of lipid plaque, suddenly ruptures and there's a blood clot that forms, and suddenly there's a cardiac arrest because there is what we call as ventricular fibrillation, or what I said, the trembling or the stoppage of the heart. And those who are under the age of 35 who have some kind of congenital problems, for example, they may have hypertrophic cardiomyopathies, or they may be having some rhythm disorders, as was found in Christian Eriksen. Now, these may not be picked up even on routine testing, but you must realize that at the highest level of exercise, when you're going for a marathon, for example, 1 or 2 in approximately 150,000 runs will die. In fact, in the Bombay Marathon, we have seen more than that. I've accompanied the marathoners sometimes. And in the Indian subset, we see many more in the intense exercise. This has happened even more after the COVID. And we see young people in gyms, where the gyms do not have defibrillators, have been at the mercy of sudden cardiac arrests, and people don't even know what to do. I feel that our program, where we've taught more than 200,000 people so far, is a program that people should join. And that's why we want to propagate this news that people can be saved. More than 50% of people can be saved if they get CPR and if they get the AED in time. Thanks so much.
Right. Dr. Pinto, very important points you've highlighted there. So high intensity exercise acutely increases the risk of sudden cardiac arrest or sudden cardiac death, as Dr. Pinto has highlighted. And strenuous exercise actually raises the risk of cardiac arrest, even in individuals with no prior history of heart disease. Dr. Lokhandwala, how important is it that people whose relatives suffer from heart disease learn CPR?
Extremely important. If we look at the incidence of cardiac arrest and death because of cardiac arrest, it's estimated as up to 20 lakhs a year in India in 1 year. And in Mumbai itself, it amounts to about 25,000 a year. The highest risk are those who have had some heart disease. For example, if people have had a major heart attack, these patients are up to 20% risk. That means 2 out of 10 patients will suffer a cardiac arrest within a year. So you can imagine how important it is for family members. In fact, we make it a policy in our hospital that when a patient is discharged with serious heart disease, the family members are told about and told to learn and taught CPR and the use of a defibrillator. Because without that, to save a patient is very, very unlikely. Every minute lost after cardiac arrest, 10% less chance of saving the patient. So if you think I'll take the patient to hospital, the battle is lost. During a cardiac arrest, as Dr. Brian always says, you are the hospital. You have to take matters in your own hand and save patient till help arrives. And therefore, for this high risk group, it is mandatory that relatives know about cardiac arrest.
Well, Dr. Sinha, what steps should a bystander follow if he or she recognizes that someone is having a cardiac arrest before performing CPR? What is the process of CPR that the person should follow?
So most of the people want to help but are clueless about how to help. Now what happens is when you witness a cardiac arrest, what you have to do is do 5 things. First thing, establish and confirm that it is a cardiac arrest. Second, call for medical help. Third, ascertain and see to it that there is scene safety for yourself as well as the person involved. Start chest compressions and attach an AED. So how do you confirm that it is a cardiac arrest? What you can do is tap the person, call out the person loudly. If the person doesn't respond, tap the shoulders vigorously. No response, patient is unconscious. Check for breathing. Breathing you will check by putting your hands in front of the nose and mouth. No air blast, or put your hand on the chest, upper part of the abdomen and lower part of chest. No breathing, no movement. That means it is confirmed that the person has a cardiac arrest. Please ask somebody to call, or you call for an ambulance, a cardiac ambulance, which usually comes with an AED. See to it that you are in a safe scene. If you're in the middle of the road, please move aside. Please ask people to help you and move aside. And start the important part, that is chest compressions. Chest compressions have to be started by placing your hand in the middle of the chest bone. So that is, if you draw an imaginary line between the nipples, that is where you will put your dominant hand, place the heel of your dominant hand, your other hand, place the heel on top of the wrist of that, interlock your fingers, hold your elbows straight so that the elbows are straight and the pressure of your body gets transmitted from the shoulders. Start push hard, push fast at a rate of 100 to 120 per minute so that you can achieve a depth of 2 to 2.5 inches. Only this effective compression will be able to rush some amount of blood to the brain. And what happens is, this is during this time also recognize and identify 2-3 people in the audience or in the crowd so that they can see what you are doing and ask them to keenly observe what you are doing so that they can continue. And you have to continue compressions either till medical help arrives or till the person regains consciousness.
Dr. Manju Sinha, thank you so much for actually crucially demonstrating that for us and our viewers. It's time for us to take a quick break, but these experts stay on with us to help you understand sudden cardiac death as well as the role of CPR in saving lives. We'll be back in a moment. Expert cardiologists are with us to bust all the myths that you have and answer all your queries. Let's go across to Dr. Pinto. Doctor, cardiac disease builds up over a period of time. We are aware of that. Are there any tests that can be done to detect heart disease early? Can regular monitoring through these tests help to prevent heart attack or cardiac arrest?
Parmeshwar, very, very important question, may I tell you. I always say by the age of 20, you must know your blood pressure, you must know your lipid status, that means your cholesterol and other lipids, and you must know whether you're diabetic or not diabetic. So that you must know even before the age of 20. And in high-risk individuals, those who have family history, you may even know that before. Now, besides that, you must check all the time for certain things. If you check your blood pressure and you know that you're in the normal range, then you can check it once in 5 years. If you check your sugars and you're in the normal range, you can again check it once in 5 years. And your lipids. Now, if any of these are abnormal, for example, if your lipids are abnormal, your cholesterol is too high. And when I say too high, it's above 150 for Indian people, because South Asian people actually have more heart disease, as you have pointed out. And it's important for us to keep our cholesterol below 150. It's important for us to keep our LDL or bad cholesterol below 100. And if people are at high risk, then they have to keep it below 70. And if they are at very high risk, then they have to keep their LDL cholesterol below 50. Similarly, it's important to keep blood pressure below 130/80, tend to bring it to 120/80, and also to see that you are not diabetic and what we call as HbA1c is below 6. We also have to stop smoking, take care of enough exercise, sleep adequately for 7 hours or so, and see that we are not too much in polluted areas like Mumbai. Get a break sometimes and reduce psychosocial stress. So if we do all this, we will reduce mortality by almost 90%. And this will also reduce sudden cardiac death. So these are the ways in which we can help our people to get better and know better. Thanks so much.
Right, Dr. Pinto, lots to unpack there. Thank you so much for breaking down the details for us. Blood pressure, as Dr. Pinto mentioned, is one of the most significant markers for a heart attack and hence should be screened regularly, as Dr. Pinto has highlighted. Dr. Lokhandwala, how exactly does an automatic external defibrillator help a person who is in a cardiac arrest? And for those who don't know, in your fraternity, it's probably referred to the AED, but it's actually the automatic external defibrillator.
Yes, Parmeshwar, AED is a machine like this. It's a lightweight machine, it's portable, it can be carried and you can run from one place to another. To use a AED, you have to remove it from the box, and many people are worried about using an AED. It's actually supposed to be what we call actually foolproof, and even a lay person should be able to use it. So this is an AED, it's very small, and when a person is collapsed and CPR is being done, remember with CPR you can save up to 10% of people. If you have a defibrillator with you along with CPR, if a defibrillator arrives in a few minutes, you can save up to 50% of people. So what you do is, it's very simple. There's nothing to be worried about using an AED. It's battery operated, battery lasts for 5 to 8 years. So what you have to do is just open and automatically it comes on.
From the patient's chest.
So as you see,
look carefully at the pictures on the white adhesive.
There is a voice prompt. All you do is pull out the pads, and it also tells you where the pads are to be attached. So all you got to do is attach. The massage will stop for a moment. You will attach one pad. You will attach another pad. It's telling you also where to attach the pad on the chest, on the left lower part. So you attach the pad, and the machine does the rest. You just sit back, and the machine is analyzing.
No one should touch the patient. Analyzing. Shock advised.
Now it says shock advised and says press the red button. So all you do is press the red button. Shock delivered.
Be sure the ambulance service has been called. It is safe to touch the patient.
So
start CPR.
So it's that easy. So there need not be any, people are very worried that there's a machine there, but I don't know how to use it. You don't have to know how to use it. It may be the first time in your life you're using it. Do not hesitate. AED analyzes. It is extremely safe and extremely effective if used promptly and correctly. Thank you.
Lokhandwala, you've made it look so easy. Thank you so much, actually, because this is such an easy demonstration that people may be apprehensive about. But just for our viewers, the AED, as Dr. Lokhandwala just demonstrated, is a small, lightweight, battery-operated device. The battery, as Mr. Lokhandwala said, lasts about 5 to 8 years, and it's also portable. When appropriate, the AED delivers an electrical shock to the heart to restore its normal rhythm. Dr. Sinha, now there's always a fear, if a person giving CPR is not well trained. Are there any medical and legal risks regarding CPR?
The maximum harm you can do is not doing anything. So that can be the maximum harm that you can do. The 2016, there is a Good Samaritan law. So what happens is most people get very worried about going forward and helping anybody. But the Good Samaritan law, which was passed in 2016, exonerates any bystander who comes forward to help a person. What can medically go wrong is that your hand's position may be a little faulty and you can cause some amount of rib damage, or that this may not be effective enough. But that is the only way that the person can be revived. So you have to come forward and help, because you're the only person over there who has witnessed the cardiac arrest and can take the person and help the person revive. So even if there is some small amount of rib fracture or anything, which can be handled later, nothing to worry. The one other thing is that you do not have any legal authority to declare a patient dead. So you still have to take the person to a medical facility who can declare the person. So other than helping the person, you can't do any other harm.
Right. Thank you, Dr. Sinha, for clarifying that. Dr. Pinto, I'd like to rope you in now. Let's just talk specifically about sudden cardiac arrest. What is the treatment for sudden cardiac arrest?
Sudden cardiac arrest is where you become the hospital. That's the first thing you must know. Do not try to transport this person to a hospital, because the person will die in the ambulance or die in the car. That's the worst you can do. You must start CPR immediately after you recognize this is sudden cardiac arrest. And as Manju and Yash already said, you must look out for people in the audience, in the area, who can help you, because in a minute or two you will get tired. So the next person, and we've had people do that. We've had people, trained, who have given bystander CPR near Otters Club, where we've trained people. We've trained so many people that we've had almost about 8 or 9 people being revived on the road. This is very, very important for Mumbai and for our country, because before that nobody used to get revived on the road. And therefore you start this massage, as Yash and Manju pointed out, at a rate of about 100 to 125 with your elbows locked and with your body weight coming over the person. So you should be on a hard ground, either on the ground or on a bed, but hard. And you do not worry about breaking ribs. You may break a rib or two, but that's nothing. You have to give this massage continuously, because with this massage you're giving about 30 to 40% of the output from the heart to the brain. So you'll keep the brain and the kidneys hopefully alive. And if you get the aid, as Yash said, within about, just with CPR, 10% of the people will come out. But if you give the aid a shock, then almost 50% of people will come out. And the earlier you deliver this, the better it is for the person. We've done this. We've then brought people to the hospital. Some of them need an angiogram to be done. We've done that. Some of these patients have gone for bypass surgery after that. Others have had angioplasty done. We've had young patients, we've had old people, and we've been able to revive them. And that's really critical, and that's really very important, because it's a shameful thing if you let a person die of sudden cardiac arrest.
Right. Dr. Lokanwala, what if the person has an ICD or a pacemaker and they have a cardiac arrest? Can we perform CPR on such patients?
Yes, if a patient has an implanted device like a pacemaker here under the collarbone, you can safely perform CPR, you can safely deliver a shock with a AED. So whether it's a pacemaker or a defibrillator, this should not stop you from doing resuscitation with massage and delivering a shock if necessary. I must add that to what Brian said, that many doctors and organizations all over the country have taken this up in a big way, and we have a cardiac arrest awareness every year for the last 2 years. And hopefully this movement will spread all over the country. And importantly, the police, many police force and railways are being trained. So I think our country will get there. As we always say, hum honge kamyab ek din.
Right. Thank you so much, doctors, for taking out time for us and joining us on the broadcast. We hope we could answer your queries regarding cardiac emergencies. Thank you, doctors, for joining us and clarifying our questions. And thank you all for watching. Goodbye.